I know a lot of patients have issues with toxicity that's involved from the different chemotherapies. And so what we've learned now is that the CLGB study shows us that you can pick whichever biologic agent and whichever chemotherapy agent, and you'll probably have the same outcome. So it really comes down to a doctor-patient discussion, as it always should come down to a doctor-patient discussion, but even more poignant now where we're really focusing on looking at quality of life. And so when we look at the toxicity profiles, the adverse event profiles for the different chemotherapies that we could use and the different biologic agents we could use, that's a decision that needs to be made together with the patient and their physician. For instance, one of the chemotherapies that we can use is called oxaliplatin, and that can cause numbness or tingling in the fingers or toes. Another chemotherapy, irinotecan, can cause hair loss. And that's pretty significant for a lot of people. In fact, studies have shown that changes in how skin looks and how hair looks have major impact on patients' quality of life and overall satisfaction with their treatment, which we can all understand. When we think about the targeted agent to work with, the cetuximab causes an acneiform rash on the face, as does panitumumab. And when patients are on first-line treatment, those patients are on for 10 to 12 months of their lives. And so when we think about quality of life when it comes down to skin toxicity, a lot of my patients in particular say, I don't want to look like that person that's been sitting next to me in the waiting room who has the pimples on their face. And so really where it comes down to is re-impressing on the physicians that they need to talk with their patients and talk about these side effect profiles. Because now that we know that we can pick the treatment, then it really comes down, as it should, to patient choice and patient tolerance and patient satisfaction with the treatment. In the first-line setting treatment, the first regimen that patients receive for their metastatic colorectal cancer, we have to make sure that patients are going to do well and tolerate this regimen well, because they're going to be on it for a good year and hopefully even longer. And so it's really important as a physician to have a good conversation with the patient about what toxicities are expected.